All right. Hello, and welcome to the UCSF Dental Public Health Info Session. We are delighted that you are here. My name is Katie, and I'll be facilitating today. Can everyone see my screen okay?
Mm-hmm.
Okay. Right, so here's our agenda for the day. We'll start with introductions, and then we'll go over the public health program, and then we'll save lots of time for questions and answers. And we really like to get to know you. So if you like to put your name, where you're going to school, when you plan to graduate, and anything else you'd like to share about yourself in the chat, we can get to know you. It'd be really nice.
Mm-hmm.
We really like to make today informal. So if you have questions about the dental public health specialty, you can ask our alumni questions about what they're doing, kind of why they chose to go into dental public health, and how the UCSF program helped them to get to where they are. So we have our rock star panel here that is going to introduce themselves. They'll give their name, the year that they graduated, and also their career focus and interest. So we'll start with Dr. Eni.
All right. Hi, everyone. My name is Eni Obadan-Udo. I am, the program director for the DPH program. I have been program director for 4 years now, since 2019. That's 3 years, right? 3.5 years. And before that, I was the assistant program director. I've been at UCSF now for about 6.5 years. So I finished my program from Harvard in 2016. My career has focused on increasing access to dental care and improving the quality and safety of dental treatment. So it's a little bit of a mixed bag, like before you get into the dental office and after you get into the dental office, what happens? And really, I've also been very passionate about education. So that's why I've been doing this, just really trying to inspire the next generation of DPH specialists. I think that's it. All right, I'll pass it on to Lisa.
Hi, good afternoon, everyone. My name is Lisa Behrens. I graduated from the UCSF Dental Public Health postgraduate program in 2007. I graduated from dental school at UCSF in 2000. So I didn't go straight through, as you can tell. There were, 6-7 years in between. I had to take an MPH. That took a year. So it didn't come to me right away that this is what I was going to do, but eventually led down this path. And so now I am, this program is really close to me and my heart, not just because I'm a graduate of it, but in my division, which is oral epidemiology and dental public health, I'm the chair of that division. This is the main and the only, postgraduate program that sits in our division. So we are very much committed to seeing this program, maintain high quality in terms of the program, the curriculum, and the residents that we train. So Eni is our leader and has really transformed this program into what it is today. You'll get more details about some of the different aspects of the program that has certainly been enhanced over the years during her tenure. My area of research is in promoting oral health during pregnancy. And I've spent a number of years trying to develop interventions for women, pregnant women, on how we can get them to take better care of their own oral health. And as that has impacts on not only their own oral health, but their children, their to-be-born babies, their oral health as well. And another part of my work that I get to do is more on the implementation side, and that is cavity-free SF. And that is a academic community partnership. It's actually a collaborative of multiple multidisciplinary and diverse stakeholders all around improving children's oral health in San Francisco. So it's really neat that I get to not only do work, behind my computer doing research, but also strategize and talk and meet with a lot of other oral health stakeholders in the city that aren't academic, but, maybe in the health department and other in the school districts and other partners that we have, to try and think of ways that we can really apply what we know works, evidence-based, and translate it into real world problems that we have, which we certainly have a lot of in our own backyard here in San Francisco. So it's really gratifying to be able to do sort of both spectrums of dental public health. And with that, I will go ahead and pass it on to Dr. Bonava.
Hi, everyone. Welcome. I don't know, can you hear me?
Yes.
Okay. Sorry, my Wi-Fi is not very good. Welcome, everyone. I'm Sepide Bonava. I'm a dentist and a specialist in restorative dentistry and dental materials, and also dental public health diplomate. I graduated from UCSF dental public health program in 2019, and I really enjoyed the program. In case my Wi-Fi doesn't it's not good, I just wanted to say two main resources that UCSF DPH program has. And it's really important in a successful residency program, is rich resources and supportive faculty. So I was really lucky to to be in this program, and I'm deputy of Dr. Eni, assistant to Dr. Eni as program director, and my focus area is in caryology, dental caries prevention, treatment, oral health literacy, disparities, and data science. I'm really happy to be here and see you here. Hopefully we'll see you in the program soon. And I pass it on to Navita, Dr. Navita Claire.
Thank you, Dr. Bonava. Good afternoon, everybody. Thank you for being here. I'm a foreign trained dentist, graduated in 2013, and I graduated from UCSF in 2020. I was in the dual program with UC Berkeley and UCSF for the MPH and DPH specialty. Currently, I'm a public health dentist working with underserved population in Texas. My career interests in dental public health have been revolving around the children's dental health and fluoridation, so like how fluoridation impacts that. So I haven't found my niche yet, but I'm working towards it. So that's me.
Great, thank you. And now we're going to switch our focus a little to talk about reflections and to hear from our panel. So our first question is, and if you have your own questions you want to ask our panel, please put them in the chat, as well as like your name. So panel, why did you go into dental public health?
I can start first and then everybody can chime in. Sorry, Dr. Behrens.
That'd be great.
So to me, I think I graduated in 2013 from India, and I got heavily involved with the local dental community, and we used to do a lot of community dental work. So that made me realize that I needed to learn academically more about like public health, community dentistry, about epidemiology, about biostats. So I ended up like applying to programs here, and luckily got Berkeley and UCSF. I think I hit the jackpot there. So I got to learn about like general public health in Berkeley. So during my one-year course with Berkeley, I think I kept missing about the oral health component. I mean, Berkeley is really good, but you still, being a dentist, I think you miss that part wherein you're trying to relate the examples of epi or biostats or, behavior change when it comes to oral health. So that's what everything was more clear. I was very happy that I did the DPH at the time, because everything I learned in Berkeley and when I came to UCSF, all those examples, they fit so well, So I think to me, it was more of a gradual path, like my interest, my heart is in public health. So I think, DPH was the right choice for me at the time. So
I can share a little bit. So my path, as I alluded to, was a little bit, wasn't clear cut for me. If I had to skip to the end and give you the answer why, is because I don't think I discerned carefully enough when I went to dental school. I was young, undergrad, wasn't totally sure where my passions were. And I could tell you my passion was not in looking at teeth, but I went for it anyway, just because, I was strong in certain areas, and it just felt like a good, practical sort of decision for my future. So, I'll be upfront and say that it wasn't like some decision out of, strong desire or passion to go to dental school. So anyway, I went through it, had a great time. But I just kind of went with the flow, didn't really question my decisions, obviously, during dental school, because I just went straight through, did well, practiced for a couple of years. And that's when it really hit me, thinking, oh my gosh, am I going to really do this every day for the rest of my life? And that kicked in pretty soon, like I'd say about a year after I was able to enjoy the fruits of, working as a private practice dentist, and not having tuition was not nearly anything like it was today. So I paid off all my loans, bought my first car, rented a really nice loft, 1-bedroom loft here in Soma, San Francisco, right across from all the fun nightlife and stuff like that. So I was enjoying it. I was like, hey, this is great being done. And this is all from like just working 2.5 days a week, because I was volunteering at other clinics for free, because I always had a heart for that. So anyways, the private practice world got really old quickly. I saw the pressures I was an associate, the pressures of the owner dentist, needing to produce, and then the pressure is put on me to do things that maybe I didn't agree with in terms of diagnosing and treatment planning. And so all of that sort of came to, and I had an identity crisis of my profession, career. What am I doing? I spent a couple of years just kind of searching. I worked as a waitress as a restaurant. My parents were so disappointed that I was like mopping the floors. They're like, we supported you going to dental school. You're a dentist, and what are you doing working in a restaurant? So I went through some of that, and then I realized, I need to do something, and I need to do something hopefully that is related to, the time and energy and money I spent investing in becoming a dentist. And that's when public health became a possibility. And I looked into it. I got in touch with some of my old professors who were, to this day, like Dr. Gansky, Dr. Weintraub, Jane Weintraub, who I credit to bringing me back. She's now gone in University of North Carolina. And I just really loved the idea of public health, something about it in terms of, helping and community-oriented, community-minded really spoke to me, and felt like I could, it really, struck a chord with my core values and beliefs. And I thought, how great to be able to use that and have that type of value, and use my old, the background that I have, and build upon that. And so it just seemed logically like a great fit. And I didn't really even know what public health was. I honestly did not know what it was until I enrolled and went to my first class at Berkeley. And wow, that 1 year of public health training like far surpassed my 4 years in dental school. I think it was the first time that I was forced to really think. And dental school just feels like you're memorizing and you're, cramming for exams, and then you clear your brain for the next exam. It's just like regurgitation. At least that's how I felt about it, back in the late 90s. And so it was really refreshing to be able to go to school, be surrounded by all these brilliant other students, not in the dental profession, mostly in medical and nursing. And so I loved it. I loved that 1 year at public health. And then it affirmed my decision to go into public health, did my dental public health residency under Jane Weintraub's mentorship, which was great. And that's how I ended up where I am. So definitely not, a straight path that was laid out for me, but, one with some turns and dead ends. But I'm so thankful for all of those experiences that brought me to where I am now.
All right, I can go next. That's so interesting. I didn't think I ever had the real story. So that's nice to actually hear your evolution and transition through different phases. Like, wow, mopping the floors. I mean, I can just imagine how your parents felt, but I kind of came into public health very differently. So my mom was a public health person. And so I got exposed to public health very early. She worked at the airport, so she was kind of very involved with like disease outbreaks, epidemics, pandemics, food inspections, things like that. And so she worked with a doctor that I admired so much. And so I wanted to go into medicine to do public health. But in Nigeria, where I grew up, you just apply to the university and you indicate like your first choice, second choice, and it depends on, where you land. And so there's a lot of lobbying that goes into it. So somehow I ended up, I didn't land in medicine, and I landed in dentistry. And I'm like, what the hell is dentistry? Okay, so my mom tried to convince me that don't worry, dentistry is still a good profession. You're still in healthcare. And by the way, you can distinguish yourself because it's a smaller profession. Well, that's what I ended up doing. I was best, student in like whatever, all the courses pretty much. And so that was it. But I still had that budding desire for public health. And in my final year, we got to do a lot of public health. So in Nigeria, both the medical students and dental students trained together for like out of 6 years. I think for 4 of the 6 years, we kind of do exactly the same thing. And we only spend 2 years in dental school doing procedures. So you pretty much grow up with the medical model and the medical mindset. And in the final year, we did a lot of public health. So there was a lot of, trips to rural communities, providing care, screenings, all of that. And then there was a lot of emphasis on research in the final year. And I think that shaped my, choice to keep going because I already had that budding interest, but I realized that, I wanted to do more research. I wanted to do more public health. So I applied to do my MPH at Harvard, got into the MPH class and learned about quality improvement. And wow, that was my own wow moment because I did a class with Professor Lucian Leap, who was like the grandfather of public health and patient safety quality improvement and patient safety. And so I found my way back to dental school from the School of Public Health and decided to do dental public health and specialize in dental public health. So I did my doctoral training in dental public health and finished in 2016. So that's kind of my convoluted path back into dental public health. And really, I think for me, a lot of it has just really been focused on research. While I was a student, I realized I also enjoyed teaching. And so I did a lot of tutoring during my residency program. And then towards the end of my program, I started developing courses. So I also realized I enjoyed that, and so that has pretty much been my, career path, both education, teaching, and research. And a lot of the work I've done have been around that.
Wow.
Okay,
thanks.
I think I'm the last person. So I was a dentist and faculty in my country, Iran, for over 20 years. I was a faculty for 16 years doing research, and also at the same time, I had my own office. And after years of working, practicing in office and also in the school, I realized that it's not enough for me. I didn't really want to just focus on individual level. I learned that in addition to individual level, treating patients, I would like to do more. I would like to go to, community level practice or work in community level to improve oral health in the community. So that's why when I moved to US in 2014, even though in the beginning I tried to go to other specialties, like pedodontist was the other, specialty that I really liked it. But I realized that, okay, I have to go to, dental public health, which is close to what I had in mind to work in community level. So I got my MPH in University of San Francisco, and then applied to dental public health at UCSF. I learned a lot, and I really enjoyed the program and courses, and also because of my clinical experience, I could link between those areas that need more work and research. So right now I'm doing research, teaching, and I really enjoy working in community level. Thank you.
Great, thank you. It's like, I feel like I get to learn more about each and every one of you. It's wonderful. So we do have some questions in the chat. One of the questions is, say you're a dentist and you were trained in another country and you've done your MPH here in the United States. Can you apply to the UCSF Dental Public Health Program?
Yep, the short answer is yes, you can apply. As long as you have a master's from the US, you can apply. And we'll go into the application process after this. So if you want to hold on, we'll just walk through the application process.
Is the program full-time or online?
It's full-time. It is not online. So you need to be in San Francisco, or at least close to San Francisco, within commuting distance to San Francisco. And then I think Rubina had a question about what's the difference between public health and dental public health, especially in regards to the program process and job prospects. Lisa, would you like to take that? I think you're on mute. We can't hear you, Lisa.
Sorry about that. I was just saying that Marina, I was writing back to Marina in the chat that the DPH program is 1 year, but you need an MPH. So that could be 1 or 2 years. Yeah, the difference between public health, I saw that question and I was sort of reflecting on that. Well, there's a lot of similarities, the public health principles and the philosophies, the 10 essential elements, and the 3 core functions of public health also apply in dental public health, but obviously we're more specialized and dealing with the oral health of the public. So, I mean, that's sort of the short answer. But in regard to the program process, I'm not sure what you mean by the program process. Do you mean like the curriculum and the?
Yes, like the academics, like the studies and everything.
Sure.
I'm already.
Yeah, so everything that you will learn will be public health, but in the dental health setting. So if you're doing, any research projects, they have to, be related to dental public health and the issues that are relevant to dental public health of our day right now. And if you're doing any kind of field site work where you're doing more hands-on or experiential learning, you will be placed at, a site that has dental care delivery. So that's
a good way to segue into the slides. So Katie, because we do have just a little bit of a description of what dental public health is and what the competencies are for dental public health. So So I can go through this just to kind of help clarify some of your thinking and understanding about it. And if we don't answer your questions, feel free to put them in the chat again. But I think that was really nice to be able to reflect on all our experiences and to learn from all our panelists about, their interests and what they do and how they came into dental public health. We have more questions for our panelists, but I'll just run through these slides so that at least you have a basic understanding of what dental public health is. So this is the definition that the American Board of Dental Public Health uses. And essentially, like Dr. Behrens was saying, it's really about community effort. So we deal with preventing and controlling dental diseases, promoting dental health. We really think about the community as our patient, as opposed to the one person who sits on your chair as a dentist. And so we're trying to apply whatever research is conducted to the public. We're trying to administer dental care programs, and we're really focused on prevention. So how can we prevent dental diseases? How can we prevent people from needing to receive dental care pretty much? How can we keep them healthy in the community? How can we help them maintain their oral health so that, they don't need a lot of treatment, So that's what dental public health is about. So it's really thinking about population level oral health as opposed to individual level oral health, which is what we do in the chair side. Next slide, please. So for dental public health, the goal, and that's the distinction between the MPH and the DPH program. So in your MPH, you're focused on the core public health functions, and you're really trying to develop skills in the 5, core areas. So biostatistics, epidemiology, health management and policy, social and behavioral health, environmental health. I think those are the core things, and there's also ethics. But when you switch over to dental public health, now you take those things that you've learned and begin to apply them to oral health. So you still need that background in biostatistics and epidemiology, but then more specifically, you apply those skills and knowledge to oral health. And there are 10 competencies that the Board of Dental Public Health require that every program, offer, and really that every DPH specialist develop skills in. And we know that everybody cannot be like perfect in everything. So usually people choose 1 or 2 areas to focus on. And so the 10 competencies, I have the words like the keywords on the left side, but really we think about managing oral health for the population, ethical decision-making and the practice of public health. So really, how can you apply the principles of ethics as you design programs, as you, approach community members? How do you ensure that there's equitable distribution of resources and that you do not marginalize any group and that you're sensitive to cultural issues? And then the third one is evaluating systems of care that impact oral health. So the dental care delivery systems, which is kind of what I do in quality improvement and patient safety. So how do you ensure that when patients come into the clinic, they're not harmed by the treatment? How do you ensure that we maintain, the utmost, the highest quality standard when people come? How do you ensure that people's, that the dental services are properly financed? And so really trying to think about the systems that through which we deliver dental care. So payment systems, payment models, and all of that. And then surveillance systems to measure the oral health status. So when we think about population health, we think about population level metrics. So we're actually looking at, plaque index and all those other things in the mouth. At the population level, you want to know about, the prevalence of disease, how often or how many people visit the dentist, how many people have caries, or have had caries in the past, how many people are getting their treatment needs met. And then the fifth one is communicating about oral and public health issues. As you can imagine, oral health is sometimes not considered, top priority. And so we need to constantly, be able to advocate for oral health, which kind of ties into the seventh one, which is advocate for public health policy. But you need to be able to clearly articulate why it is that oral health is important. Public health as well. I mean, we all saw the pandemic and how we have underinvested in public health and in the public health infrastructure. So both oral health and public health have those, challenges. And so you need to be able to clearly communicate and articulate why oral health is important, why public health is important, and why the government and, even private, institutions and organizations need to invest in public health and oral health. And then by definition, because you're working with community members, you need to be able to build coalitions. You need to be able to develop, bridges between different groups. And there's just a skill required to lead those collaborations and ensure that everybody is happy. And then I already touched on advocacy. Then there's the literature, which is learning how to appraise the evidence. So there's an explosion of publications, scientific manuscripts, and all of that. And how do you sift through all the noise to ensure, especially in this age of disinformation, misinformation, infodemics, you want to be able to read through a manuscript and quickly decide if this is garbage or if this is actually good science. And so you go through that process, learning how to critically appraise scientific evidence about oral health, and then conducting research. So you would personally, half of your time actually will be spent conducting research to address oral health and public health problems. And then lastly, we also try to integrate social determinants of health, because we know that, the healthcare system is not the only thing that affects health. There are so many other factors, like where people live, the educational levels, food security, things like that, all play a role in the level or the quality of healthcare services that people receive, access to food and access to a good diet that would help them maintain good oral health, all have a role to play in how people's ability to maintain their oral health. So these are the 10 things that we try to focus on during the program. And the manuscript where these are published is on the left side there by Altman and Mascarenas. This was published in 2016, and it's still the current competency that we use today. And they go into much detail for each competency and what that means and what it entails and what the intent was behind it. So it'll be helpful if you want to know more about dental public health to read that manuscript so you can learn more about it. All right, next slide. All right, where do they work? So these are a few of the places where you can work as a DPH specialist. And there's so many things that affect people's ability to work in the United States. But if, there were no visa issues and there were no licensing issues, then these are places that you can work as a DPH specialist. A lot of times people go into government agencies, so you can work at the federal level, at the state level, or at the local level. At the federal level, you have the Indian Health Service, you have the US Public Health Service, you have the CDC, HRSA, which is the Health Resources and Services Administration, and you can also work for the NIH. At the state and local level, you have the Public Health Department, you have the Office of Oral Health in California here, and every state has pretty much an Office of Oral Health. And in California, every county now has a local oral health program. And that's kind of what we want to see across the country, so that every public health department needs to have an oral health program so that they can be thinking about the oral health of their community. And then you can also work in the military. And then you can go into clinical practice, which is what Dr. Kaller is doing, Navita. You can work in a public health setting. So you can work in a prison, you can work at a federally qualified health center, community health center, and just really work with underserved populations, so people who otherwise do not have access to dental care. And then you can do what I'm doing and Lisa's doing, which is education and research. So you can work at the School of Dentistry, School of Dental Hygiene, a School of Public Health. You can also work in, Head Start and school-based programs, with the community, providing services, to remote locations like rural areas. And then you can also do consulting. So some people have done that, work with nonprofit community-based organizations. And you can also work at the policy level, advocating for oral health. There are lots of agencies, there are lots of organizations that do advocacy work for oral health, and you can do that as well. All right, next slide. Okay, so this is just a little bit about our program specifically at UCSF, and this is our webpage. In case you haven't been there, please go there. We try to provide as much information as possible on the website, but if there's anything you don't understand, feel free to email us and we'll happily clarify, answer any questions. Next slide. So the structure of the program, the UCSF program is 1 year, but we do have a joint program at UC Berkeley. So if you're interested in dental public health, but do not already have an MPH, which is a Master of Public Health degree, then you can go to UC Berkeley or you can apply to UC Berkeley for their 1 year interdisciplinary MPH program. And the way that works is that when you apply for that program, you can indicate that you're interested in the UCSF DPH program as well. And so you get interviewed by us at the time of application and get accepted into a 2-year track. So you do your first year at UC Berkeley and then automatically transition to UCSF. And that's the route that Navita took. She did the UC Berkeley MPH first and then did her second year with UCSF. We have a student currently now who is also on the same track. And I believe I see Haprit, who is at UC Berkeley right now. Haprit, are you there?
Yeah, hello. I'm so excited to be here though.
Right, we're excited to have you. So that's kind of, maybe you can share your experience at UC Berkeley right now, but that's an opportunity for people who do not have an MPH to get into dental public health. But you can get your MPH degree from anywhere. Once you have your MPH degree or once you're in the MPH program, then you can apply to UCSF as long as you're going to complete your MPH by the start of the UCSF DPH program, which is July 1st every year. Next slide. And the structure of the DPH program is that it is based off of the knowledge you gain in your MPH, which is in general public health. So we expect that you would have taken the core courses, the 5 core courses, like I said, biostatistics, epidemiology, social and behavioral health, environmental health, and healthcare management and policy. So we're not really expected to repeat those courses. You're meant to build on your knowledge of those courses and really focus on applying that knowledge to oral health. And so the second year is a residency where you get to apply the knowledge and learn more specifically about oral health issues in public health. And so we provide instruction in dental public health through several methods. We have several courses and we can, go into detail about the courses if you like. But for now, just know that the courses are focused on the 10 competencies. We also, our residents also go through what we call the field site experience. And the slide just went off, Katie. Okay. Okay, so the field site experience is a real world exposure to public health. So this is where you go to a local oral health program or, a school-based program. And recently we added a federally qualified health center so that you can learn about how to think about, oral health issues for the population, think about services that are being provided to vulnerable populations, and how to address them and address those needs. So you come up with a program, intervention, or something to help support the work that is happening at the local oral health program. And this recently has been supported by the California Office of Oral Health. Like I said, every county in California has a local oral health program, or at least almost every county. I think there are 59 out of 61. So essentially what you do is go into the county, and this is why we need you to be available, because you have to go into the county, you have to experience it, you have to meet with people, you have to support the work that is going on in the community. We have an emphasis on rural counties, much more than urban counties, but there's still opportunities to work in urban counties if you like. And then the last bit is research. So like I said, half your time will be spent conducting research. So you need to be able to lead a research project. Actually, 2 research projects. One would be focused on research methodology, and the other one would be community focused. So a lot of times people tend to find their second projects at their field sites or through their field site experience. And next slide. All right, and so like I said, recently we added a few courses. So this is a HRSA-funded grant that allows us to pay for, to offer scholarships to our residents. But beyond offering scholarships, it allows us to co-learn with pediatric dental residents. That allows the dental public health residents to co-learn. So it's kind of like an interdisciplinary thing. Through this, next slide, we're able to offer 4 specific things. You know, the first is, like I said, the co-learning. So pediatric dental residents get to learn about dental public health, and dental public health residents get to learn about pediatric dentistry. So you learn about, you know, very basic skills that are necessary for in public health settings. So behavior management, how to handle children with special healthcare needs, how to conduct oral health exams on kids, you know, how to provide anticipatory guidance, and some atraumatic restorative techniques. And then the second piece of this is to work in federally qualified health centers. So this is where we have partnerships with a few FQHCs, and you can go there and work on quality improvement projects, administrative projects to improve the service delivery of dental care. Our residents also work on medical dental integration projects. So how do you ensure that, you know, our medical colleagues are working to improve oral health? So referring the patients, if it's OBGYN, or, you know, if it's pediatrics, you know, how do they get to screen those kids and get them established in a dental home? And then the third piece is, like I said, a rural community focus, where our residents get to be immersed in rural local oral health programs. They have field site rotations there. And we're piloting a virtual dental home project in a school-based program in Tuolumne County. So we work with the pediatric dental residents to provide services, but dental public health residents help with, you know, the administrative bits and with the evaluation, as well as, you know, troubleshooting. So like right now, our resident is thinking about how to increase the number of referral sites that accept the kids from the virtual dental home, and how to get them enrolled in Medicaid and things like that, you know. So we think more holistically and more population level than the pediatric residents who work one-on-one with the patients. And then the last piece is just focused on expanding the pipeline and growing the specialty. All right, next slide. And this information is on the website, but I wanted to just emphasize that we do have funding for US citizens and permanent residents. We also offer a stipend through the Office of Oral Health, the California Technical Assistance Center. The stipend is variable from year to year, so it's dependent on the availability of funds. Right now, the funding we have is $10,000 per resident, and we pay for your travel to the local oral health program. So we can pay for up to $5,000 per year for your travel. So we cover like your, you know, car rentals, your meals, and all those other things. So essentially, it comes to about $15,000 per resident, and that is open to non-US citizens and non-permanent residents. And then, of course, you can also always apply for financial aid. All right, next slide. And this is just the application process. Again, this information is on our website, but the application opens in May and ends on February 1. We use PASS, a DIA PASS, and there's like some supplementary application fee that is due to UCSF on February 10. If you're applying to UC Berkeley, you do not need to complete a PASS application. All you need to do is just apply to UC Berkeley and just let them know that you're interested in the 2-year program, and they'll reach out to us. Our interviews generally are held in February or March of every year. And once the interviews are conducted, we send out the admission information acceptance letters late March, early April. Next slide. And these are things you need for your application. Next slide. All right, questions. Okay, so any questions from the chat while I was speaking? Or you guys can just ask questions directly. We'd like to hear from you.
Oh, it looks like there are a few questions here. For job perspectives in dental public health differs from having an MPH.
Marina, do you want to speak up? Can you talk?
Yes. Hi, everyone. Thanks for letting me have the chance to attend this meeting. Yeah, I was just wondering if there is like opportunities more if I got enrolled for the DPH after my MPH. I already been the MPH in a different school, which is Grand Canyon University, and I have one more year, so it's like been like 2.5 years now, or almost 3 years. So I'm just wondering if I got another year for UCSF, is this matters like in jobs perspective, or like it will be different, or it's worth it, I'm just trying to understand more about that.
So, like I always tell people, I think your job prospects depend on your skills and your experience, and so it's very difficult to tell you kind of where you can land and where you can't land because I don't know so much about you. But with the additional training that you get from the dental public health program, you're able to work more specifically on oral health programs and oral health issues. So dental public health is a specialty in dentistry, which MPH is not, right? So with the MPH, you can do more generic public health jobs, right? But with the dental public health, you can do more specific dental, and it just gives you additional time to hone your skills. It gives you additional time to develop and to become more confident, more knowledgeable about things in public health. So it all depends on you, your status, what you're trying to achieve, and it gives you that additional time to achieve those goals.
Is this year considered a residency year?
Yes.
Okay. Thank you so much for answering that.
Sure.
Thank you for the question. We also have a question from Ravina. She'd like to go into a little more depth into the subject ENL, I believe, as mentioned. Ravina, do you want to unmute and kind of share a little bit more?
Yeah, when Annie was talking about the program, she did mention about that. That like if you would like to me to like go into the depth of the subject, if that's possible.
Sure, I can share my screen actually because I pulled it up. So I can talk about the specific courses. So this is the coursework so we have some core courses and some elective courses, and you can take even more elective courses at the School of Berkeley or across UCSF. But for the core courses, we have a guest lecture series where we invite, specialists in dental public health, people who are doing things across the country, to come give us guest lectures about whatever it is they're working on. So this week, for example, we had someone from the CDC talk about the new Healthy People 2030 objectives. And then the second one is the public health projects. Like I said, half your time is going to be spent on research projects. So you're going to be designing a project from scratch, collecting the data, analyzing the data, and presenting your results, and hopefully publishing a manuscript. The good thing about it is that once you're done with your program, you have 2 projects that you can submit for your board exams to become board certified. And then the third is the core and contemporary topics in dental public health. So this is where we discuss, topics like, fluoridation, anything that has to do with like the core public health skills, so workforce, dental public health workforce and things like that. And then the field site experience, like I said, is where you go into the community and work with a local oral health program and get to practice dental public health. The other one is quality improvement in dental care settings. So here you work on a quality improvement project at a federally qualified health center or a school-based program. And you really are just trying to improve the quality of care, either within the dental department or between medicine and dentistry. And then the last is an intro to dental public health. This was just added last year, but it deals with some, introductory level topics. We talk about social determinants of health, cultural competency, health literacy, health promotion, things like that, but as it relates to, oral health. And then of course there are electives, so you can do ethics. These are courses with the other clinical residents. So they're not just dental public health courses. And then you have Intro to Research Methods, which is led by Dr. Banava. Dr. Banava, do you want to talk about that course?
I think she lost her Wi-Fi connection.
Oh, okay. All right. So this is an Intro to Research Methods, where you talk about different study designs. So it kind of builds upon what you learned in your MPH. And then we have an Intro to Biostats. So what I tell people is if you are confident about your EPI and Biostat skills, you can actually test out of these courses and do more advanced EPI and more advanced Biostats. And then we have topics in pediatric dentistry, like I said, where you learn about basic pediatric dental skills that you can use in public health settings. Does that help?
Yeah, absolutely. Thanks a lot.
Sure. All right, Harpreet, you're raising your hand.
Yeah, I wanted to know that it's for the pediatric one, the SMILE. Do we have to apply a separate application, or is it a course integrated into our like an elective or something?
So that's the course for the pediatric topics. That's the elective course. And then the Intro to Dental Public Health course is also taken by both pediatric dental residents. So that's where they get to learn about dental public health. So it's a course that is taken by both pediatric dental residents and dental public health residents as well. And then the quality improvement course as well is taken by both groups. We do have a medical dental integration workshop and a virtual like telehealth workshop, teledentistry workshop. So those two workshops are being led by, faculty who, but one of them is Dr. Susan Fisher Owen. So that's kind of roped into the DPH 420, which is your field site experience. But those workshops are also with the pediatric dental residents.
Okay, so it's like an elective course. We don't have to go for another application.
No. There's no separate application. If you want to apply to pediatric dentistry afterwards, then you get to meet the pediatric dental faculty, but that is a whole separate conversation.
Yeah, sure. But it's a great opportunity, and I'm so glad that I'm again hearing about dentistry at UCB. It's all MPH and global maternal health, but I'm really excited to be here. Thank you so much for this webinar. Yeah.
Sure. I feel like Yazaman had a question, but it looks like she's dropped out, right? Yeah, so yes, you can apply with a foreign dental degree.
So Annie, I have one more question. I don't know whether or not that question is appropriate. I mean, I was just wondering, like for interview for the DPH program, like, is there anything like, I mean, what should we expect? That type of a thing, if that is okay for you to share.
Maybe Navita can share her experience. Or Navita, did you go through an interview? I don't think so. We had not done that in your time.
Yes.
But Harpreet went through an interview, right?
Yeah, I went through in like mid of Feb.
Yes.
Before coming to UCB. So yeah.
Do you want to share your experience about that?
Yeah, actually, I was pretty excited about it, but I know like you all know this feeling. Yeah, my heart was so racing because I wanted it so much. But the experience for me was, it was not that kind of interview where you get super nervous about. Everyone was so super friendly, and they asked me about like why I wanted to join DPH and what do I see, where do I see myself, and what do I want out of this degree. that was some of the main topics. And a few other, they talked about, actually they were like, all of people, all of the staff were so friendly. They explained about the DPH curriculum and the opportunities here beforehand. And I guess it was more of a interactive interview kind of, yeah. But not really, you have to study really hard, but you have to be well prepared for it. Yeah, I can say that. Yeah.
Thanks a lot, Harpreet, for sharing your experience, because that's what I feel. I'm like so passionate about applying, and I'm like, what am I gonna say? Like, what to expect? You know, like especially when it comes to interview, it's kind of like,
Yeah.
you know, pumping. My heart is pumping already.
Yeah. Yeah, but it's like, just like, you have to be clear what you are really looking forward for, and you have to be expressive about it, and you're like how passionate you are. So that's what I think was the main.
Yeah, that's amazing. It's great. Thanks a lot for sharing your experience.
Anytime.
And in terms of formats, we usually have a panel. At least 3 faculty members would be on the panel, and they will take turns asking you questions. So it's just a 1-hour interview. It's usually done on Zoom, at least recently. It used to be in person, but recently it's been done on Zoom. I think we're going to keep that going forward. And so it's just really to be prepared, you know, and ready to answer questions. We're really just trying to assess your commitment to the field of public health, dental public health in particular, and just your understanding and your knowledge about, you know, the specialty. All right, I see that we're almost at time. We haven't heard from Pamela
We have
and
one.
Martha. Do you guys want to tell us who you are and when you're interested in applying, or what your interest is in dental public health?
Hi, hello. My name is Marta. I foreign graduate from Colombia, and right now I working as a dental hygienist at the NIH and in Bethesda. And I really start to understand a little more about the public health and the need that we have all in all the country. And my focus is in patients with special needs, and I want to do more for the patient, because when I came here and I start to make all the process for the convalidate my degree, I noticed and I say, okay, I can help one patient at a time, but this is not enough for me. I want to do anything more. I was when I realized that through the public health with different policies or different I don't know I don't know how to explain that, but yeah, with different programs, I can help more people at the same time, and this is why I want to apply. Right now, I started taking classes online with the university in Connecticut. It's a Bridgeport University, because in this moment I want to continue working at the NIH, and this is why I decide to take the classes online. But when I'm finished, I want to continue and apply for dental public health, because this is what I want to do. And when I received the invitation for this webinar, and I say, yeah, I want to start to know how is the process and everything, because I'm finished with the master and continue with the dental public health, at the same moment. Yeah,
Sure.
this is why I'm here. Yeah.
Okay,
And thank you so much
much.
information. Thank you.
Sure, happy. Feel free to reach out to us when you're ready to apply. And just
One
before we go,
question before we close, is there any need to take a dental board exam before enrolling?
No. All right, Pamela.
Penny, I have a question. So while you were presenting, you mentioned about some board exam. So is there any board exam by the end of the program?
Yes, so the American Board of Dental Public Health is our specialty board. And so you usually take the first part of the board exam before you're done with your program, and then the second part as soon as you're done with your program.
Oh, I see.
Yes, so you become board certified. All right,
Mhm.
quickly before we go, I want to hear from Pamela.
Hi, yes. I'm actually a first year dental student at the University of Washington. I was here more to just hear a little more about dental public health because it's an interest of mine and I'm kind of like trying to figure out what I want to do.
Okay.
So thank you for sharing all of your stories.
Yeah, sure. And feel free to reach out to us. We're happy to shepherd you along the way and maintain your interest in dental public health. All
Thank
right.
you.
And that is our contact information if you want to take a screenshot or take a picture. And with that, Katie, do you want to take us away? You're mute, Katie.
I am a habit of Zoom. Thank you everyone for joining us today. It was such a pleasure to meet you, to share about the specialty, to hear about your dreams and goals, and to hear from our wonderful faculty and alumni of their journey into dental public health and just seeing what the specialty can do for just healthier people. It's incredible what oral health means and how we can really promote it. So thank you so much for your time today. It's wonderful to meet you. If you have questions, please reach out. We're here and we look forward to hopefully meeting you. So with that, we'll go ahead and close and thank you so much.
Thanks a lot, everyone. It is so useful. I mean, I can't thank you enough.
Thank you.
Happy
Thank you so
holidays.
much, everyone.
Thank you. Take care. Happy holidays.